Hi, I'm Jayla McAuliffe. I'm a student in the Rural Family Nurse Practitioner program at EKU. Today, we are going to discuss childhood obesity and how increasing physical activity and implementing proper nutrition has been shown to help decrease obesity in children and adolescents aged 2 to 18. According to the Centers for Disease Control and Prevention, the CDC, approximately 20% of children and adolescents in the United States are classified as obese. This alarming statistic highlights a significant public health concern as childhood and adolescent obesity not only increases the likelihood of obesity in adulthood, but it also is linked to various serious health complications such as cardiovascular disease and type 2 diabetes. By addressing obesity in its earliest stages, it will help promote a healthier future for our children. By focusing on proper nutrition and encouraging increased physical activity, we can help children develop lifelong healthy habits. The theoretical framework. Obesity in children and adolescents has emerged as a significant public health concern, particularly as it serves as a vital health indicator for the Healthy People 2030 initiative, which seeks to enhance the overall health and well being of individuals nationwide. Recent statistics reveal that a staggering 19.7% of children and adolescents aged 2 to 18 are classified as obese. This alarming figure underscores the pressing public health challenge we face in addressing this epidemic. To effectively combat the rising obesity crisis, we can embark on a journey of lifestyle modifications encompassing various aspects of our daily lives. Emphasizing dietary changes, increasing physical activity, and implementing behavioral interventions are essential strategies that can foster healthier habits among children and adolescents. By prioritizing these non pharmacological approaches, we aim to reduce the incidence of type 2 diabetes and significantly improve the overall health outcomes for our young individuals. The studies revealed several noteworthy similarities. Each study implemented interventions focused on enhancing physical activity and promoting a balanced nutritional diet. A common theme in the successful studies was a robust support system for the children and adolescents that were involved. This support often came from various sources, such as family members who encouraged them, school personnel who provided guidance, teachers who monitored their progress, or friends who joined them in their activities. Overall, the findings suggest that children tended to thrive when they had a reliable support system cheering them on and helping them stay motivated. One limitation identified in the studies is the lack of noticeable changes within a short time frame. A more extended period of intervention is necessary to achieve a significant reduction in the BMI. This suggests that immediate results may not reflect the potential long-term benefits of the program or treatment that's being evaluated. During the research study, it became evident that while several studies have focused on adults and their decreasing BMI scores, extensive research is lacking on children and adolescents. There's only a limited number of studies that have examined the awareness of dietary restriction and exercise as weight control methods in children as young as 5. The peacock question. In children and adolescents aged 2 to 18 years old, increased physical activity and a proper diet compared to a sedentary lifestyle and poor nutrition could lead to a decrease in overall BMI Z-score within 6 to 12 months. To implement this plan, the project leader should be someone experienced in evidence-based practices and skilled in working collaboratively with interprofessional teams dedicated to combating childhood obesity. Each member of the project leadership team should be assigned roles based on their current position within the community or practice. The team may include providers, teachers, schools, after-school programs, and representatives from the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC. For this group, meetings will be necessary every 3 months during the project implementation. The project duration will range from 6 to 12 months. A longer duration will only have better results. The first step in the action plan is to identify and recruit patients. The process involves identifying patients between the age of 2 and 18 who have a higher body mass index or BMI. These individuals should be generally healthy without any significant comorbidities that could hinder their ability to participate in physical activities. Specifically, they should be capable of engaging in activities such as walking, which will be essential for this particular study. Careful screening and assessment will be conducted to ensure that all selected participants meet this criteria, allowing for a focus on their physical health and activity levels. An initial BMI measurements, including their height and weight, will need to be recorded. Their current physical activity and proper nutrition dietary intake will also need to be reported. The last part of this action plan is teaching of ways to increase their physical activity and a guide on making proper and healthier nutritional choices. The timeline for outcomes based on evidence and the Peacock question is between 6 to 12 months. Many articles have suggested that the longer the timeline between the initial assessment of the BMI, the better outcomes. Ideally, there would be a check-in at the halfway point as well. This study is significant because it addresses an important gap in current research. While many studies have focused on strategies to reduce the BMI, most have mainly targeted older age groups. This research, however, aims to explore this topic within a broader demographic or different age group, providing new insights, potentially even more effective methods for reducing BMI in younger individuals.